Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Through a total knee replacement 2 weeks ago.
2 weeks ago, and so you had it
Monday
in
would be 3 weeks.
All right. So how much pain do you feel now in your knee?
3 to 4.
3 to 4. What's difficult for you to do after the surgery?
Bending
Your knees. Okay.
straightening the knee.
Straighten the knee, and okay. So let me see how you bend now. So it's a little stiff here. So almost 90 degrees. How much pain with that?
That was a good. That's about an 8.
Okay, let's try it again. Bending, straight and bending. Okay, that's 8 out of 10.
That's as much as I can take.
Push your knee down. So he's about minus 15. You see that? Okay. All right. Bend your knee. Okay. So he's like at 91. So I'm not gonna work on this area, just because you have inflammation there. Just gonna loosen up everything around. Okay. How does that feel? Make sure it's not painful. Okay. Okay. Too much?
No, it's manageable.
Oh, while you're here, let me do this. Okay. Make sure that's not painful, okay?
It's just like right at the.
That's okay. All right. Okay.
We had such a hot summer, hot winter, and now all of a sudden.
Okay. You have a scar tissue here too. You feel that?
Yes.
Make sure that's not painful, okay? Yeah. So it's fine.
Yeah.
Okay. How long has this been going on?
Since September.
Okay. 105 was 91. Okay. Straight your knee. Okay. Push down. Okay. Still like minus 10. Okay. So let's 0 to 10.
2 to 3 now.
Okay. Where do you feel it?
Some pain here and here.
Relax. Make sure that's not painful. Okay.
It's painful when you're pushing.
Yes. No, that's painful. Okay. Okay. Try it again. How's that?
Same, like a 2 to 3.
2 to 3, and you feel
Less
it in the same.
painful than when I first started.
That's beautiful. Okay, where do you feel it now?
Right over here.
Okay.
Probably normally so pain. Normally so, I would think. I mean, pain's not going to go away.
Well, if it's related to your inflammation, no.
Exactly.
If related to soft tissue, we can work on it to get it down. So I'm just ruling this out to see if it's inflammation, because you can get both knees. You can see how much swelling, so that's probably from the swelling. But what I care about, as long as you move easily and more like loose, and actually let's get the whole picture. That's a good sign. How does it feel now? Moving faster.
Much better.
Yeah. So what do you think about ASTR treatment?
I love it.
Yeah.
so far.
Yeah, awesome. Thank
I
you so
love
much.
my first 20 minutes.
Yeah, awesome. Yeah.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.